Good morning. I'm here today to share with you an experience that I had which no other parent or loved one should ever have to go through, and to begin a new conversation on how addiction and addiction treatment is perceived. On the evening of August 20th, 2012, I sat beside my daughter in a hospital emergency room and watched helplessly as a calamity of tragic errors and the misjudgments of hospital staff took her life. The hospital wasn't new to us, nor was my daughter's condition new to them. Even so, she went undiagnosed for hours while I watched her respirations grow shallower and her oxygenation rate decline to the point where she finally went into cardiac arrest. It was from a drug overdose. My daughter's name was Jack. She had the richest brunette hair, big brown eyes, dimples. And she would have you in stitches the moment that you met her. She was kind, she was generous and loving. And in addition to all that, she was an opiate addict. What appalls me about admitting to you that she was an opiate addict is that as soon as you have heard that about her, that's how you'll perceive her from now on. And you're not alone, because as her family, we didn't want to have to admit that there was an addict amongst us. And it was because of our embarrassment of her that we left her alone to deal with her addiction on her own. Her friends and her community shunned her because they could no longer understand the person that she had become. Our legal and judicial systems incarcerated her for the crimes she committed in order to fund her addiction, but did nothing for her in the way of rehabilitation or understanding what she was going through and how she had gotten there. Healthcare professionals, tired of her and in frustration, put her to the bottom of their lists. Even when she was sober enough to ask for help, it was nowhere to be found. Even I, as her mother, was more concerned about the shame it brought on me, and it stopped me from providing the love and the support that she was so desperately in need of. For far too many years, we all only knew her as an addict, and we forgot that she was also a human being. We dehumanized her by not providing the necessities she required in order to simply stay alive. We judged her as not being deserving. The definition of dehumanization is described as a denial of humanness to a human being. It is theorized to take on two forms: animalistic dehumanization and mechanistic dehumanization. It occurs through the language and the actions that liken certain human beings or groups of human beings to non-human animals. And that is what we're doing to the people that we love and that we should be caring for. Not only did we dehumanize and stigmatize Jack, but we left her with nowhere to turn for the help that she needed in order to stay healthy. So what changed my mind, and how did I come to the attitude that I have today? Well, the rock bottom that I was so patiently waiting for Jack to hit finally did. And coincidentally, it was also my rock bottom. A few months before the hospital visit that I just described, I arrived home after a long day at work to receive a call from a hospital telling me that my daughter had been admitted with flesh-eating disease. It was caused at her injection sites, and it was caused by impure heroin and the levamisole that was used to cut it. They told me that they were rushing her into surgery, likely to amputate her legs, and that they didn't have time to waste. But Jack insisted that she speak to me before she was put under, to tell me that she loved me no matter what. And then the phone went dead. In the end, she didn't lose her legs. It was already too late. We were told that the infection had spread into the trunk of her body and that it wouldn't be long before it took her life. I can't even begin to imagine what went through my daughter's mind when at the age of 34 she was told that she was going to die. That's usually when we have all of our dreams ahead of us and we're starting to meet them. When Jack was out of surgery and coherent enough to be aware of her grave situation, I was able to ask my daughter how she wanted to spend the time that she had left. And without hesitation, she turned to me and she said, "I want to teach you what it's like to be me, what it's like to be an addict, what it's like to be treated this way. I want you to walk in my shoes and see this through my eyes and have an understanding of it so that you can share that with others." So for the few short months that she had left, that's all we did. We talked. I listened. I examined what was going on with her. As her mother, standing by my addict daughter, I endured, to a lesser degree, but I endured the same stigmatization from her caregivers. Some of them, and I say some because there were caregivers, thankfully, there were a few that were able to make me understand, give me a different perception of things, help me see it through my daughter's eyes. They helped me to understand that addiction is a disease, that it is treatable, that there are many people out there that are just sitting on the sidelines needing for change to happen. Change in our Canadian drug policy, change in our attitudes. Most importantly, education amongst society. We have to look at this in a different light. Prohibition has never worked. It probably never will work, no matter how many times we incarcerate people and beat them down. I know it firsthand. I've experienced it. I'm up here sharing Jack's story with her voice, and I'm starting a conversation to make change. I hope that you've heard my words, that you at least consider what I've had to say, and if you can't consider it, at least have the conversation. Thank you all very much.
Good morning, everyone. My name is Hedy Fry, and I'm the Member of Parliament for Vancouver Centre. I'm also the Liberal health critic, and I am a physician. And my experience with addiction, I think the first thing I wanted to say is we have to look at addiction as a disease. I think you heard that very clearly in this very moving story that we heard about Jack. I think the idea that we would try to stop someone with diabetes from getting insulin or from getting the treatment they need, because it is, in fact, a disease, is what we do with people who have the disease of addiction. We do not treat it as a disease that needs to be treated with the usual type of public health initiatives. And so I think that when we spend 95% of the money in this country on enforcement and not on looking at a comprehensive, integrated method of treatment, I think we've missed the boat, and we have condemned a whole lot of people to stigma and to death. Now, I just want to say that I came about this as a physician, having spent a lot of time pushing very hard in my own province to deal with addiction as a disease and to deal with it with the proper public health issues. One of the speakers here today, I worked very closely with, Don McPherson, when I was made the minister for the Downtown East Side, and we looked at what addiction had been doing, the overdose deaths that had been occurring in the most dehumanizing ways, with people dying on the streets and in the alleys in Vancouver's Downtown East Side, unable to get the help that they needed right away. And I had traveled with some other MPs to Europe, and I had looked in Switzerland at what they were doing with safe injection sites. And there I learned that you could actually, recognizing that these are people, recognizing that these are human beings, recognizing this is a disease, you do everything you can, as you would for every disease, to save lives. And so with the mayor of Vancouver at the time, we started to talk about how we could develop an insight, as we now call it, a safe injection site in Downtown East Side as a project. It was done as a project with UBC. It was clearly a very well-written clinical project. The results of it was not only to save lives, but we saw at Insight that in fact a lot of people who were high risk, and this was only for the high-risk users, that in fact, when they came to Insight and they found that they didn't have to die, that they could live, they began to get hope. They learned how to trust the medical team, the doctors and the nurses that were there, and many of them began to want detox. And so we developed a 25-bed unit upstairs of Insight called Onsite, in which these people were able to go and detox and actually look forward to a new life. Now, this is threatened to be shut down by a really heinous bill called C2 that is coming up in the House of Commons. It treats people with addictions. It is an ideological bill. It treats this, I think this is something that you should know, that this bill was brought in by the Minister of Health, and instead of going to the Health Committee, the bill is going to Public Safety Committee. It shows the way that people see and that this government looks at addictions. It looks at it as a public nuisance. It looks at addictions as something that is a criminal behavior, and it seeks actually not to be able to give people the care they need, but in fact what it seeks to do is to find a way to criminalize them even more. And I think this is awful because it is trying to stop not only new safe injection sites from being set up in communities across this country, but it is trying to stop the one that is already there in Vancouver, in spite of the Supreme Court ruling that said that life, liberty, and security of the person is actually what is being contravened in our Constitution when this government tried to stop Insight. So I want to make a plea right now for a very comprehensive public health attitude and policy towards addictions. And it should start with prevention. It should move on to harm reduction. And harm reduction is a dirty word for a lot of people. But we practice as physicians harm reduction in every single other disease. We try to minimize the harm done by the disease and create a better quality of life. That's what harm reduction is. It's not some kind of magic thing. It's a real public health strategy. So prevention, harm reduction, treatment, and rehabilitation, and of course enforcement leveled against those who exploit persons with addictions. That is organized crime. And in every place, in Australia, in Europe, where there are safe injection sites and where they have taken this particular comprehensive approach, public health approach to addictions, we have seen the change in how addicts are treated. We have seen the way that they're treated as a medical problem, and we have seen that the criminal elements are in fact going down. And this is really, really important. I could go on further about how treatment means not just trying to find a way to detox, but trying to find a way for substitute drugs for those who are addicted. And so, you know, I could go into dopamine and into the brain and into all the reasons why addiction is a disease of the brain. And I can't right now because I know there are lots of people who want to talk. But I think it's time that we begin to become civilized in this country, that we need to look at an evidence-based